Continuing on with chapter 21, reassessment. So we want to continue to reassess the patient to make sure that they're not getting worse. So every 15 for that stable patient, every 5 minutes, or literally constantly for a patient that's consumed an extremely lethal or harmful dose. We just want to make sure that we stay on top of those vitals so we know if they're trending downward or not. For the most part, our treatment is going to be more so just supporting the ABCs. We're not going to do a whole lot. And so we want to continue to check our interventions and make sure that everything is okay. Make sure that the oxygen is doing well, making sure that if we're irrigating or flushing any sort of contact point or their eyes, etc., that we're getting a good flush on whatever it is. And then communicating and documenting, reporting as much information about the chemical or the poison to the hospital. And then if it happened in a workplace setting, making sure that you have that materials data safety sheet so that they have that additional information. First and foremost, scene safety, scene safety, scene safety. Follow any standard precautions needed depending on what the substance may be, and then make sure that you decontaminate yourself. If they have tablets or fragments of whatever substance they've got, go ahead and wash or brush it from their skin. If they have medications or something in their mouth, very carefully remove it from their mouth. I would use a tongue depressor. I do not stick my fingers in patients' mouths, except if they're like severely choking and I just need to pull something out of their mouth. But I have watched too many people get chomped down on with teeth, and so I'm a little nervous about putting my fingers in somebody's mouth when they have teeth. But try and get it out if you can. You're going to assess and maintain ABCs, treat for shock, and promptly transport. Like we talked a little bit earlier, some EMS systems do allow EMTs to give activated charcoal. You should know how to use that if your system allows you to have it. The whole thing of activated charcoal, it doesn't actually dilute or render some sort of toxin unharmful. What it does is it binds to those toxins, binds them together, and binds the outside with this thick substance so that it can theoretically pass through the rest of the digestive system without being absorbed in any way. We don't use that for patients who have ingested alkali poisons, cyanide, ethanol, iron, lithium, methanol, mineral acids, or other organic solvents, or if they have a decreased level of consciousness and can't protect their own airway. We sure as heck don't want them throwing up this really thick, nasty material and then ingesting it or inhaling it into their lungs. So what's likely going to happen if you have activated charcoal, you're going to have a plastic bottle that's either a premixed solution or something you need to just add a little bit of water to in order to dilute it out. Some common names for it are Instachar, Actidose, Liquidchar. The usual dose for an adult or a child is 1 gram of activated charcoal per kilogram of body weight, so that can be 30 to 100 grams for adults, 15 to 30 for children. Before you give that to the patient, you want to make sure that you've obtained approval from medical control, that you shake the bottle vigorously, like get after it a little bit to make sure that it mixes well. It's very probable that you're going to have to convince your patient to drink it. It doesn't smell great. It certainly doesn't look great. And a lot of times your patient's like, yeah, I'm not putting that in my mouth. If at all possible, put it into a opaque glass, one of those plastic cups that everybody uses so that they can't see it, and let them drink it through a straw, preferably one that's not see-through. Even the white ones, yeah, it's going to color it a little bit, but if they don't see what they're drinking, they tend to do a little bit better with it. Make sure that you record the time that you give that activated charcoal. If they refuse to drink it, make sure that you thoroughly document their refusal and then transport them for further evaluation. We can't ever force a patient to drink it, but make sure that you counsel them on what the ramifications could be if they don't end up drinking this. Some side effects of having activated charcoal are constipation and then black stools. Again, it binds up all that material that they have ingested and helps it pass safely through the digestive system, and so it's got to come out somewhere. So that black is going to end up dyeing their stool for a little bit. If the patient has ingested a poison that can cause nausea, they may vomit after taking activated charcoal, and the dose will have to be repeated. So if their stomach's already irritated, throwing that thick charcoal on there, not going to help them. For specific poisons, over time, a person who routinely misuses a substance are going to need increasing amounts of that substance to achieve that same effect. And I've mentioned this before, that whole thing is called tolerance. They develop a tolerance for a substance. Then a person that has an addiction basically just has an overwhelming desire or need. So it's either mental, physical, psychological, both at the same time, that they just have to have this substance, and it doesn't matter what the cost is to get to it. And almost any substance can be abused. So it's important to stay aware of your safety and make sure that you have standard precautions. Known drug abusers have the likelihood of having a serious undiagnosed infection such as HIV, hepatitis. Oftentimes they're very unpredictable as far as their behavior. They might bite, scratch, spit, or hit because you're messing with their high. So you want to make sure that you always, always, always use the appropriate protective equipment and always expect the unexpected. It's typically the drug user rather than the drug that's going to pose the greatest threat to you. Alcohol, we have several different calls that are connected to alcohol every single year. It's ridiculous. 1 in 10 deaths among working age and the adults can be attributed to excessive alcohol use. Alcohol damages the liver. This can either be through chronic overuse or just occasional heavy use, which we call binge drinking. But it goes through and is filtered out through the liver, and so the liver kind of takes the brunt of that. Chronic use typically isn't as bad as binge drinking. That steady exposure to alcohol, your body kind of gets used to after a while. But if you are just up and down, up and down, up and down, as you expose to that alcohol, that can be pretty rough. Alcohol itself is a powerful CNS depressant, so your central nervous system. It has sedative effects as well as is a hypnotic, so it decreases activity and excitement, and it induces sleep as well. It dulls the sense of awareness, slows reflexes, and reduces those reaction times. It may also cause the user to be aggressive, have inappropriate behavior, and lack of coordination. And then alcohol tends to increase the effects of other drugs, and it's often taken with other substances. A person who is intoxicated may have another underlying issue, so we need to not just assume though, that they're intoxicated, we need to look for signs of head trauma, mental illness, toxic reactions, or uncontrolled diabetes. Just FYI, severe acute alcohol ingestion may cause hypoglycemia. So always check a blood sugar. If the patient experiences CNS depression, we want to protect that respiratory system first and foremost. The depression of that respiratory system can also lead to emesis, aka vomiting. Vomiting can actually be super forceful or have blood in it because large amounts of alcohol end up irritating the stomach really, really bad. Internal bleeding should be considered for any patient that appears to be in shock. Patients with alcohol withdrawal may experience frightening hallucinations or a condition called delirium tremens or DTs. This syndrome is characterized by agitation and restlessness, fever, sweating, tremors, confusion and/or disorientation, delusions or hallucinations, and seizures. Patients actually become so hyperthermic that they can completely overheat. So we have to be very careful when we're dealing with these types of patients because we can actually cause them to have sometimes lethal reactions because of their DTs. We will go ahead and stop here and I'll continue on in the next one.